everyone, and welcome to Top Tips for Archaeology graduates. Today we are joined by Sophie. Hi Sophie, how are you today?
Hi Penny, I'm really well, thank you. How are you?
I'm well. I'm really enjoying your bright orange top. It's really adding some sunshine to this grey day in York. So Sophie is a registered nurse, and she's come along today to talk a little bit about her transition from archaeology into nursing. And obviously we're just coming out of COVID at the moment, so she's been busy, really busy, helping out the NHS with that, and we're really glad that she's made some time today to come and talk to us about studying archaeology and then going on to study nursing and working as a nurse. So maybe you could tell us a little bit about your job as a nurse. What is your day-to-day job like, and what are some of the things that you do?
Okay, so day to day, we do have several things which fit in a normal template. We come on and I look after 11 guys and girls, and we do regular medication, observations, which we have to check blood pressures, temperature, respiration rate, anything which can help give us an early indication that someone might be declining in their health, which is so important. I don't know how many people will be familiar with the term sepsis, but that is a real nasty thing. It's where you've had an infection that's developed to a point where it can become life-threatening, and we have to be really hot on checking these observations of patients because it can help us identify that really early and potentially save someone's life. Other general day-to-day cares, we work really closely with medical team, with therapy teams, particularly where I am. My unit, we specialise in step-down care. So patients who've been in hospital really unwell, but still need to finish treatment, they come to us and then we can continue that treatment. And hopefully 9 times out of 10, they end up going home. Occasionally someone might decline again and go back. And it's just a case of balancing it out and getting the best outcomes for those patients. On top of that, we have discussions with social care teams, relatives, which have become quite a new thing again, that we've had to adjust to having family and friends come and visit. And yeah, so with COVID, it's been an additional element to our day-to-day care that we have to account for.
Thank you very much. That sounds like a very varied job, and also quite challenging, but there are things that you must enjoy about being a nurse. What are some of those things? What are some of the things that give you a satisfaction during a day-to-day job?
Oh, I think there's so many. I think one of the biggest ones is being able to be with somebody who's at their lowest point and being able to support them physically and emotionally, and really making an impact upon their lives and even their families. We've had a real big pressure with COVID of families not being able to see relatives, so having to balance and communicate with them more. I just think it's lovely to be able to give someone that sigh of relief that everything is okay.
Yeah, that must be incredibly rewarding. What are some of the things that you found more challenging then?
I think challenge-wise, there's been a lot of extra pressures and fears from staff and from patients. Again, it sounds like you'd be banging on about COVID again. I think everyone's sick of COVID, aren't they? But that's been a really big challenge. And being a newly qualified nurse, I qualified in September, so starting my first post in the pandemic has been an extra challenge. But I think in the long run, it's going to be something to benefit from.
Yeah, I think so too, and obviously it's something you're very passionate about, and something I think that you must bring a great deal of expertise to as well. I'm sure your patients are really grateful when someone such as yourself is on the ward with them. So can I ask a question, which I'm sure many people listening are thinking about? How did you go from an archaeology degree into nursing? Could you talk a little bit about that transition? Because it's not something that a lot of people do.
Yeah, it's not sort of the status quo, is it?
Yeah.
My mother is a nurse. She works in a specialised role. And whilst I was doing my archaeology degree, I'd been thinking about things and just discussions with her really of what her role included, and I thought that actually sounds really interesting, and I'd loved doing the archaeology, so I thought I will finish doing what I'm doing and then see at the end if that's something that I still wanted to pursue. And by the time that I'd graduated from archaeology and all of the confidence that I'd gained over those 3 years of we've been networking at some of the organised events and working with different people and having that real understanding of being able to critically research and analyse information that you pick up, I felt like I was ready to give it a go. So I put the feelers out, applied for some courses, and I was very lucky. I heard back from a few universities. I had to stay local to where I live because of placements that we'd have to do. Otherwise, I'd have loved to have stayed at York.
Yeah.
Yeah, so was very fortunate. I got some offers and I finally accepted one. Started it, and honestly it felt like a puzzle piece going into place.
Oh, that's lovely. But so what were some of the differences then between perhaps studying archaeology and studying nursing? Do you feel like some of the study skills in archaeology prepared you for that?
Definitely, especially the courses that I took were quite scientific in second and third years of archaeology, so being able to research papers and to interpret and analyze and then be able to compare, that's so useful, because a lot of nursing now is more than just the day-to-day activities. We're expected to become, a colleague of mine said that it's much like mini doctors. We have to really think about treatment that we're giving, and we are welcomed and encouraged to challenge any medical decisions if we feel like for that patient it's not appropriate. So for the university side of things, it was so useful to already have an understanding of higher education writing and producing essays to a good standard, and it meant that I could really focus on the practical side, of nursing.
Yeah, that's great. Can I ask you a question, which I think a lot of people will be thinking, which is, if you had your time again, would you go straight into nursing, or would you still do your archaeology degree?
Oh, hands down, I would still do the archaeology degree. It was such a good thing for me. At 18, I was very unworldly. I was from a little village, and I needed to be able to get out in an environment which exposed me to lots of different people, lots of opportunities, and really challenge myself to become more proactive with approaching ideas and people. So I really think that if I had not have done the archaeology first, I would not have been able to have done the nursing degree as effectively as I had done.
That's really nice to hear. I certainly agree with you that I think, like you, I came from a small village or a smaller town, and studying archaeology did just open my eyes to kind of different people, global attitudes, rather than perhaps the smaller world that I've been in before. So do you draw on any of the skills that you developed during your degree now in your nursing? Do you see any kind of like paths, I guess, between things you learned as an undergraduate with us in York that you're still using now in your nursing?
I do. So obviously a lot of my essay skills that I gained from archaeology have been so useful. We have to do, as nurses, every 3 years we have to do something called revalidation. So that's to demonstrate that we're still competent to work as a nurse under the laws that govern that. And part of that element is to produce a reflective piece, which is like a mini essay dissertation sometimes. And you have to pull in so many resources and writing styles, and that's something which archaeology, from when I was studying, I remember it was very much on how you communicate your ideas and your theories, so that was very useful. I've also found it very useful with talking to patients. It's given a point of interest. We can connect. We have a lot of elderly, so lots of people who were around in the war in the 60s, and part of the modern archaeology module that I studied at York, I used a lot of the things that I'd picked up from that and was able to hold really good conversations. And patients with dementia who had been very quiet in their rooms all day, I'd come on shift and we'd discuss it and they'd just come alive. It's been so nice to see.
That's not something that I expected you to say, that it would be about building relationships with patients, but that's just lovely. I'm sure it is something that so many people are interested in, and it's such a diverse subject. I'm sure you can capture people who've perhaps been a little bit reserved and draw them out of themselves a bit. So you've spoken so wonderfully about nursing. I'm sure you have inspired people to think about it. And if you have, what kind of advice would you give to archaeology graduates now who are thinking perhaps they want to move into different medical areas, or perhaps even into nursing?
I would say always believe in yourself, because although it will be a big transition and something that you might not expect to have ever thought about going into, you've already done a standard of work to a university degree, so you know you've got it. The rest of it is just allowing you to then find your way into any of the medical professions. There is such a wide variety of different roles you can go into in medicine. It's not just doctor, nurse, physio. There are so many roles and you can change all the time. I've been looking at jobs to do with dietary advice and bone health. It's just something that's so diverse, and if it's something you want to have a go, I would highly recommend trying and see how you fare.
That's great advice, especially having confidence in yourself. Did you have an opportunity to do any kind of volunteering before you started your course, or did you mainly do that during placement on your course?
A lot of it was placement orientated, because we had different skills and competencies we had to show that we could achieve. But in the final year of my archaeology degree, I was very lucky. I had a friend who is a Paralympic rider. So I was able to go out to Rio with her.
Oh, wow.
Yeah, it was so out of the blue, and I was able to work as not just the groom for her horse, but as her carer, which again was so beneficial for moving and handling and for learning about people's abilities rather than disabilities, which has been very useful again coming into nursing.
What a fantastic experience that must have been. So on that note, we will imagine, we'll have to imagine the images of you enjoying Rio and the horse racing there as part of the Olympics. Thank you so much for joining us today, Sophie. That was fascinating.
Oh, it's been wonderful. Thank you so much for inviting me. It's lovely to see you again.
Thank you so much to Sophie, especially as we're coming out of COVID. I'm sure she's very busy. Thank you so much to you for watching and joining us. Join us again next time for more top tips for archaeology graduates.